Hello, Farmers Branch. My name is State Representative Julie Johnson, and I represent you in the Austin in the state legislature. And it is my absolute honor and privilege to do so. I'm pleased to have this chance to visit with you briefly about what's going on in our state and give an update on all of the material events that are affecting us. And I'm grateful to the Farmers Branch City Council for making this opportunity available. First of all, today is Census Day. And so it is very, very important that you prepare your census forms. You can go to the census.gov website, 2020census.gov. It's an easy form. You should have received a little blue piece of paper in the mail with a little code. It literally takes less than 5 minutes to fill it out. But it is really, really, really important that you do so, because that is what drives so much funding in our community. The census population dictates how much transportation funding we're going to get to affect our roads. It affects how much healthcare funding we're going to get in order for the hospitals and our medical providers for so much unfunded care that we have in our state, and many other programs, school programs and the like. So you are doing yourself and our community a big favor if you would please take a few minutes to go fill out the census. We still are at, I think, about 35% right now of people who've completed the census form. And so we really need to prioritize that. We're going to be escalating our communications. We have a link to the census stuff on our website at Julie Johnson for Texas. Feel free to go there. Obviously, what's affecting us right now most impactfully is the COVID situation. And, the governor yesterday recently extended the COVID stay-at-home in place for 30 days until May the 6th. And so that means that we really do need to stay at home and shelter in place. People are not doing that. And as a result, our infection rate is escalating at a very high level. Just today, in fact, we announced 100 new infections in one day. Yesterday, it was 75. The day before that, it was 69. And you can see the trend is really starting to escalate. It took 27 days for us to have deaths from 0 to 1,500 in our country, and it only took 3 days for the death rate to go from 1,500 to 3,000. So it's just going to get that much worse as every day passes. We are not doing what we need to do to social distance. I drive on the highways just to see what's going on, and the roads are packed. You drive by many stores and businesses, and they're packed in cars. People are not protecting themselves, and you guys have to do that. We as a community must take care of that. And I think there's some things we can do to try to make it more tolerable. Share recipes with your friends, your neighbors, use Zoom. This vehicle right here, I started a Zoom chat with my family that my parents are in Connecticut and they're older and I worry about them. And I'm able to lay eyeballs on them and talk with them. And I encourage you to use these new platforms that we're all trying to figure out how to stay in contact with our families. But it is really, really important. And then also take advantage of the telemedicine opportunities that you have with your doctor. If you really start to see that you have symptoms of headache, of cough, of diarrhea, of fever, and not feeling well, please check in with your physician immediately and make sure to see if you need to be tested. And if you're having problems reaching testing, please reach out to our office and we can try to connect you with testing sites that are available. We're constantly adding testing locations. Every single day I'm on a call with the Clay Jenkins, our county judge, as well as the state and the Department of Health and Human Services. Every single day we're briefed on the testing that's going on around the office, around the state and around everywhere. And so if you have any issues about getting tested or concerns about that, please contact my staff. Secondly, your doctor should be able to provide telemedicine services. The thing that's unfortunate is many folks have otherwise chronic health conditions that still require regular routine maintenance and monitoring. Cardiac care, blood pressure medicines need to be monitored, diabetes care needs to be monitored, other GI care and other issues that require consistent monitoring with your physician. Please reach out to your doctors and see if they have telemedicine available. The governor has issued a requirement that telemedicine be provided, that health insurance companies have to pay for telemedicine. And if you are aware of situations where your insurance company is denying that care for you, please let us know immediately. That is something I have been working with Congressman Martin Vesey's office on, is to ensuring that we have compensation for telemedicine at the state level as well as at the federal level. If your health insurance plan is governed by state law, which many are, the state law requires that your providers be providing telemedicine and that the carriers pay those providers for that visit. Federal law still has some kinks in it, and I appreciate the hard efforts that Mark Vesey is working on in order to try to address this and fix this. He's on the committee that regulates health care in our country, and hopefully can get CMS on a national level to mandate that insurance companies pay for telemedicine visits. If you have to have medical care resulting from COVID care, the state law now and federal law requires that you be provided that care at no expense out of pocket. So there's really not any reason why people should not get the care and the screening they need if you feel like you are sick. But what are we going on with our businesses? How are we going to continue our lives and our paychecks? You know, the CARES Act was recently passed at the federal level. And today, in fact, the small business loan process has gone into effect. You can go to our website. All of the links are there available for you. You can also go to the SBA.gov website. I have that here. And, you know, to provide some relief. So what that means is if you're an employer with under 500 employees, and you can apply for a loan from the federal government up for 2.5 months of your monthly payroll. And so you have to go, but it doesn't apply to any employee that makes over $100,000 a year. So you have to go back to your 2019 taxes and your employment reports that you filed, and any employee that had a cumulative salary, including bonuses and 401k contributions and everything, of under $100,000, and you add up that salary number, and then you times that number on a monthly basis by 2.5, and that's the amount of funding that you're eligible for. And as long as you maintain those people employed in your workforce, then you may be eligible for those loans to be converted into grants, non-repayable grants, which is essentially a wonderful benefit of infusion of capital into your business to help maintain the employment of your workforce. Because everyone has bills to pay, they have monthly obligations. And so this is a huge benefit that the federal government was able to provide to local business owners. We also have really expanded unemployment in Texas. We've done this at the state level, and then there's also a lot of reinforced benefits that the federal government has layered on top of the state government for unemployment. And a lot of the requirements of, you used to have to prove that you were seeking employment in order to be eligible for benefits. A lot of that has been waived. And so it's essentially, the hardest part about it is just getting through to the Texas Unemployment Commission. I'm told that they are hiring more staff. So if you're out there, if you're looking for employment and you want to try to make some money during this time, go apply for the Texas Unemployment Commission, because they're absolutely hiring people to help accommodate the great influx of claims that are being made for unemployment. We're expecting upwards of 3 million unemployment claims, and really taxing that agency. But fortunately, the state legislature, we have allocated emergency funds, and the governor has allocated resources to boost and bolster the unemployment claims process for people who are really hurting right now, because for whatever reason, their part-time employees or their employers just have had to shut down due to the restrictions. That gives them some resources available there. There's been a lot of concern about what to do with our prison population. A lot of people have family in our state prisons. The virus has been spreading through the prisons, and the governor has expedited a release of nonviolent criminals in order to minimize the health disruption in our prison system. So that's been kind of a very interesting topic. But he's been very clear that if you have a violent crime, then you will not be released. We're not going to expose, if bring that to our society at this point. But if you are nonviolent criminals, it's my understanding that the governor is expediting a broader prison release associated with that. Evictions is another big issue, as what to do about residential housing. It is not safe in this pandemic for people to not have a safe place to shelter and to be. And so the governor has issued a 60-day moratorium on evictions out of people's residence right now. And I think that moratorium will stay in place as long as shelter-in-place orders are in place and with an appropriate amount of time thereafter in order to regain and recycle into the workforce. And so, because it's a public health crisis, we can't have people on the street. We can't have people without a safe place to be and to shelter and their families. And so that was very swiftly enacted. Again, if you're finding any problems with an improper eviction or anything like that, please don't hesitate to contact our office, and we will be happy to work with you on those issues as well. Food security is a huge issue for people. Our school systems really are one of the main meal providers for so many residents, and even in Farmers Branch and in our school system here. We have many schools that are free lunch and assisted lunch programs, and families really rely upon that. Fortunately, the schools have really maintained that, and they're working on their food security issues for their students, and as they've transitioned into e-learning environments. But I think we still need to be mindful that people need food. And so the MetroCrest Food Pantry is such a wonderful service that our community has. I strongly encourage you to donate to them. Their resources are being taxed at a full level, and they need volunteers. They need resources to continue to provide that valuable service for so many people in our district. That pretty much covers a lot of the highlights and where we are right now. If you need anything at all, please don't hesitate to contact us. JulieJohnsonforTexas.com is my website. And we would love to hear from you, and follow us on Facebook, follow us on Twitter. We always provide updates as they become appropriate. And if you have any problems at all, we're here to serve. And it's my great honor to represent you in Austin. Thank you so very much. Stay safe. Love your kids. Be good out there. Thank you so much.